So thank you for joining us this morning from wherever, Sicily, New Canaan, and maybe those are the only two options there. Let's see. First item on the agenda is just the approval of the minutes. Thank you again, Alicia, for excellent minutes. Any questions, corrections?
I'll make a motion to move.
Second.
All those in favor?
Aye.
Thank you. All right, reports from Health Department. Jen, she was just on another meeting too. She may not be here.
I'm here.
Oh, you are, okay. Jen, want to give us the good news?
Our current case total is 254 positive cases with 36 deaths still. We've only had one new case this week of a college-age student who's out of state, residing out of state. Since our last out call last Friday, we've had an additional 123 negative tests of our residents reported to DPH. The week of August 17th, we tested 641 teachers, students, and parents, all negative. Out of that, 182 were kids under the age of 18. Again, all negative. So I was able to create a bunch of data charts and graphs for Dr. Lutzy for his back to school reopening with, the parents and the teachers. To date, our grand total of testing with Stanford Hospital and Docs is 4,802 residents, with only 11 being PCR positive. That is a test positivity rate of 0.23%. It's pretty incredible low rates, which is great news. Hopefully it stays that way. I submitted the June and July DPH crisis grant funding. We were awarded $30,202 for the health department. We have used all of that. So all of the reimbursement is submitted and pending with DPH. We are also in mosquito season, so the surveillance program is underway with the Department of Agriculture Experiment Station and DPH. Thus far, we've had 2 mosquitoes test positive for West Nile at Hoyt Swamp, none at Michigan Road, and none have tested positive for Triple E yet, and no Triple E in Fairfield County yet. DPW is still larviciding catch basins and areas, so that is good news. We've had no human cases as of yet. The septic and soil testing, plan reviews, new installation, all that is through the roof right now with all the new home sales. So we're incredibly busy, and it's way above normal for this time of year. The building permits are pretty steady. I am still working with planning and zoning, DPW, fire, and the chamber for our outdoor dining plans for the fall into winter. About what that's going to look like with, tents and all the approvals that would be needed. The daycares have been adding classrooms and additional rooms as well to meet OEC reopen guidelines. I'm working with a number of them to help them with all the local requirements of fire, building, and P&Z, as well as the state EOC requirements. And then several of the schools have erected tents that also require P&Z and fire approval as in addition to health. So we're trying to help everybody get through the COVID rules, because not everything is relaxed by the governor's orders, especially, planning and zoning stuff. So that's where we're at. Hopefully after Labor Day weekend, nobody parties too much and we can keep our numbers at bay.
Jen, what is the plan to monitor school kids, teachers, parents, et cetera? I know we did the large number right before school started, and what are the plans for following up on some regular basis?
There is no surveillance testing being done. Just whenever they're symptomatic, they go to the nurses, they're isolated, removed, and then contacts would be tested at that point. We have lifeline, so to speak, created with Stanford Hospital as part of the contract I signed for the initial testing. So, you know, if someone goes into Janet Reed's office and they're not feeling well, especially with the collision of flu season, then they can go get tested. I mean, that age group, we've never had a child under 10 test positive for COVID yet in New Canaan. So, but it will eventually happen. So you deal with it pretty much. The guidelines for state Department of Ed and DPH are very loose. So it's not like you close a school just because you get one case like the beginning. I mean, it's very flexible on how you're going to handle it, you know. So we're already seeing it happen, you know, in some of the private schools with staff. But again, they're not even on campus. It's expected you're going to have cases. It's just working around who they're exposed to, how many they're exposed to, just like any case.
Are there guidelines for whether it's safe to see one's grandchildren who are now back at school?
Well, if I were you, I would have them tested first at like a Doc's Rapid site in Norwalk, or just maintain the social distancing in the 6 feet, which obviously for grandkids and grandparents, it's not easy to do. So my recommendation would be to have them tested. In communities that have low transmission like ours, when they're, you know, sniffling or showing some of the, what are considered now COVID symptoms, most likely it's not going to be COVID. It will be flu or allergies or, you know, to that effect. But obviously without testing, you don't know, because 40% of positive tests now are asymptomatic. So
Some of our most recent positive tests were those who were off to college, for one, as just part of their protocol. But the other was families who were going to expose their children to grandparents would have them tested beforehand, and a couple of those came up positive. So the safeguard is to have them tested.
Thank you.
agreed.
So thank you, Jen, for all of the update. The statistics are very impressive in a positive sense, meaning negative testing. You know, kudos to the EOC and all those people, the whole community being involved in this in terms of wearing masks, distancing, hand washing, et cetera. We've seen the spike in Europe now, Spain, Italy, France, Germany, et cetera, not encouraging going forward. I don't know if I mentioned this to you last time. There was an excellent webinar review of where we are, the status with the immunizations given by this fellow Mulligan, who's been involved with AIDS research, et cetera, down at NYU. He's in charge of their infectious disease immunology program. So all the vaccines to date, those that he's tracked, have had excellent results in terms of antibodies, the appropriate neutralizing type of antibodies, and the T cells, which are, you know, when you fight infection, it's your antibodies and it's also cells, a cellular response in the fighting the infection. And they have had, the T cells have had good memory, et cetera. So those vaccines are looking promising. And as you can see in the paper today, in the news yesterday, the CDC is preparing the states for November to be prepared to give them. So we don't know if that's, well, is an eventuality or whatever. They're going to, I think they're going to possibly push for some increased risk taking by giving them before all the data is in, but that's where we are. Next on the agenda is Human Services Department, Adult and Senior Services, Bethany, our director.
Hi. Yeah. Good morning, everybody. All right, I'm going to start with our phone stats. Some good numbers, interesting numbers. So our last meeting in June, we had 892 phone calls. That includes incoming and outgoing. July, we had 604. August, we had 755. So there was an uptick. We did have the power outage, and definitely, you know, we were all on the phones and helping, which Marcy will go into the senior outreach as a result of that. I'll skip next to the food pantry. August, we were still serving at least 45 to 50 households. And our voucher program ended with the farmers market. We generated about $4,000 worth of vouchers that were used with food pantry clients. We are going to go to round 2 because there's approximately $3,500 left from New Canaan Community Foundation. So I talked to Farmers Market, Patricia, and we are doing round 2 again. Those will be distributed at the next food pantry and will go until October. The next thing is school has resumed and taken back over the fill in the blanks and the free school lunch program, which we took over for the summer. So that was successful, and now it's back to the school again, and the school was very appreciative that we did that during the COVID situation. Food drives are increasing now because of the kindness of St. Mark's. They are allowing us to have food dropped off on Mondays from 8:30 to 10:30 in the morning, and people have been very responsive and receptive. So we are getting an inventory of non-perishable items built up again on the shelves, but we do have a way to go. We are still purchasing. October food pantry, we will be working with St. Mark's. They have given us the okay to do a walk-in basis so we can start getting ready for the colder weather. We will go through that process. They're giving us more space so we can do an entrance and an exit, and not having to back around and go through the same entrance. So they're being very, they're definitely partnering with us. And the lease was signed for our rental agreement with St. Mark's. We were historically paying $12.50 a month. At one point, we were not paying anything. And then we did $600 a month. And now we have signed a year's lease for $1,000 a month. So we'll get going on that again. The vestry really worked hard, and we were able to go down originally from the $12.50 to the $1,000. And they've been very kind in terms of cutting us some financial pressure during the times when we were trying to build up our monetary base again. And our monetary base is definitely increased. I have to check with Joanne, but I think we now have at least, we have over $50,000 in the account for special projects that the town has so generously contributed to. And this will definitely keep us going. And that with the volunteer base, it's just an unbelievable program that we can serve our New Canaan residents. We want to appreciate and acknowledge Waveney Care. They donated soaps and shampoos that they had, and so those are also being given out to the food pantry clients. Moving on to vaccine, I have 80 doses of remaining that needs to be sent of the 320 doses I've reserved. All I did was order exactly what we did last year. And that was back in January when we had to put my order in. Well, COVID sort of changed things. We do probably need more vaccine. We're on the wait list for more. We might have the option of receiving that in November, but we will have 320 doses for October flu clinics. I have 2 set up at Lapham, October 7th and 9th from 12 to 2 by appointment only. And we are pacing that out. 10 appointments are made every 15 minutes. That sign up will start at September 28th. We do not want to do it before. Aggie will be doing the sign up on Sign Up Genius, as well as taking phone calls. If we start any earlier, people forget about the appointment or they start calling and changing it. And so we do it a week before, set in place, and it seems to follow very, very well. So this is through years of trying out new ways of doing things, and this is the most complete, efficient, and effective way. That being said, we are not having the senior men's flu vaccine clinic this year. We just can't do it. We're keeping it at Lapham, and I assume I will run out of vaccine after those two. We do have enough vaccine for the employee flu clinic, which is October 28th. So after that is over, we'll see what our supply and demand are, and I'll project from there. Get about slowly rides are increasing in numbers, and I will have took a hiatus for August, but we'll start next week with the board meetings again. And William Post is taking over for John O'Bidding, who has moved. So very effective. It'll be a very effective committee as well, and Bill will do a great job. The Red Book has been reinstated. This was the book that EMS first responders had used through the years, but for the past 5 years, there has not been one. Had a meeting with some stakeholders in town regarding the Red Book, and Human Services is going to work with New Canaan EMS, and we will have a tiered contact list depending on emergency and needs in the event the EOC is activated. But the Red Book, New Canaan EMS will be covering it, on a 24/7 basis. The tropical storm, Human Services was very effective and efficient, definitely needed at the EOC. We, during the EOC, I think in the past, we have not always had a strong presence there, and it was definitely utilized by both residents and the staff at the EOC. So we look forward to continuing that partnership, and want to thank you for Waveney as well, again, for supplying the oxygen that was needed to a resident. It was just so quick, effective, and working through Human Services. Russ, it was awesome. Nothing was missed. I mean, it was just seamless. So thank you, and thank you, for helping with that life.
Real important. I just have a quick question, if I can, Bethany. The doses that you hired, were those high doses or low doses?
So yeah, the inventory is, we have 120 high dose quadrivalent. They only make it quadrivalent now.
Right.
So the price has gone up 30%.
Yep.
So it is going to be more expensive, but Medicare, we are a Medicare provider. I keep that current. And so we will be reimbursed at the Medicare allowable rate, so we will not lose money there. And then we have 200 doses of the regular quadrivalent, preservative-free individual doses.
Okay, thanks. And then the last is, thank you for the, the breakdown on the phone calls and everything. I was just wondering, do we keep a general idea track of the reason for the phone call coming in? So we, know what the needs are. I know that, during the storm and everything, a pretty sizable amount of calls that you received, and I know handled very well, was based on that. But do we have just a general breakdown of kind of what the calls coming in are for?
No, we have the calls according to the phone number. So we have 4 lines here, and I can see, what calls are coming in. Mostly, obviously, the 3076, which is the main line, that receives the most calls. Other than in terms of, seeing what the purpose of the call is, we do not. That was attempted once, and it is very, very time consuming. We do take our notes. I can't tell you numbers, but like you said, in August, it was mainly tropical storm related, as well as, which Jackie will give, the programs that we're offering at that time. And Marcy, renters rebates going on right now. The back to school program went on, and it's sort of what programs are happening at that time.
Understand. I just didn't know anecdotally if you had a feel for kind of what the needs are.
Yeah,
right
so
now.
the need right now, we have Medicaid, Medicare, they're doing renewal and food stamps. The renewals are in the process right now. So that was some of the focus of the phone calls. And as the caseworkers go through their what they've been working on each month. Whatever that focus is, those are what the phone calls are about. So my phone calls this month, what was tropical storm, and it was Medicaid, Medicare, getting ready for enrollment, as well as renewal purposes for
Yeah.
state and federal programs.
Thank you.
Yep. All right, that's it for me.
Bethany, thanks for that. The Red Book, which is the town certainly in need of with the updating. Thank you for that.
Yeah.
Also, there was an article about Bethany. I don't know if you saw it in July 2nd, New Canaan Advertiser, about Bethany, her role as full-time director, and also about Health and Human Services and which direction we're going with some increased, providing all the services we have in the past, plus some increased comments about prevention, wellness, et cetera, going forward. Thank you.
Thank you.
Marcella,
Morning.
good morning.
Well, along with Bethany, we are continuing to add residents to our vulnerable population list. We have over 120 households who are on that list. And during the tropical storm, we saw over 50 people for home visits, just wellness calls and making sure that they had water and that they had all they needed during a long couple days of no electricity, et cetera. We're finishing up our renters rebate program, as well as beginning our energy assistance in a couple weeks. Those letters of reminder have gone out. I am getting more involved with Lapham Center. I have started a book group that starts the 21st of September, if anyone would like to attend. I am also doing a wellness group once a month with Lapham, and that first group is on the 17th of September, and that is relaxation and stress management. And I am also working with New Canaan Library. Julia Ray is starting an outreach program for homebound seniors, delivering books and audio books. And I'm working with her to get a list and sort of skills to approach these seniors. And that she hopes to start at the beginning of October. And that is what I'm.
While you're reporting, Marcy, I want to add that Marcy and Bethany took a couple of hours out to shoot part of the Telemental as the anchor group that we'll talk about later, but they did a fantastic job. We're going to make stars out of both of them. Yeah.
You're very kind.
They may be there already. Thank you for that. It sounds great for Lapham and what you're offering there.
And Marcy, I wanted to add, Marcy is now going to the training program to be a choices counselor. So we will have 2 choices counselors on staff at Human Services.
Yes.
So she's, yeah.
Great. Youth and Family Services, Jackie?
Yeah, well, I just wanted to make sure, if you haven't already, I know Lance probably viewed it, but the vigil was last night and it was amazing, a wonderful job. It was so professionally done. They had 4 people share their stories. It's only an hour. Please, please, please take the time. I had goosebumps. It was so, so good. And you can access that if you just go to New Canaan Support Group. Paul has it on his website and you can view it through YouTube or Facebook. So just wanted to share that. So we had 90 kids receive $50 back to school gift cards, and they were for either Walmart or Kohl's. We got some from Salvation Army, and then our Facebook Moms group was able to donate some money to buy those. So it was no cost to us. And families were so happy because, you know, we heard information like we don't know if they can have backpacks at one point. So instead of providing all that info, providing all those items, we figured let them just decide what they're going to need for their kids. So we did it. They drove up, they called us, we walked out with a mask, they had masks on, and we delivered the items that way. So it worked great. When school was starting, it started this week, everyone's been very happy. Their kids have had smiles from ear to ear. I've seen several of them that were coming to still pick up back those gift cards. But I had about 9 kids that parents had no childcare for them. What they're doing the month of September, most of you probably know, but it's a hybrid model. So half the alphabet is going to school Monday, Tuesday, the other half Thursday, Friday, and then they're rotating the Wednesday. Well, I've had some families that have, no financial resources and no place to have these kids go. So I work tirelessly with the New Canaan Community Foundation for funding and the YMCA, and these kids are able to go to the YMCA to tune into their e-learning, and they'll have a staff member there with them. I think it's one staff per 10 kids. I think we were also offering that to some New Canaan staff at the schools that didn't have options for their kids. So they've figured it out and they've provided the space, and New Canaan Community Foundation is able to fund that, which is amazing. It's about, I think with the holidays in September, it's like, I think 8 or 9 days. So that's amazing. Hopefully kids can just go by October 1st and we don't have this need. And I have a Talk Saves Lives event that's coming up next week. It's on September 9th at 10 a.m. I'm doing it with the library. It was rescheduled from March. We have, I think, 15 people registered already, but it's about a little over an hour. But it's really kind of what's new, the newest way to kind of intervene when someone is feeling suicidal. It's, sort of teaches people to be comfortable with talking to people, and that's a way to kind of get them to disclose. So if you can tune in, I'll make sure all of you have the link information in case you don't, if you were interested, to pass that along. One great thing that had come out of we do a lot of great things. I have a state grant that I get every year. It was through the State Department of Education. Now it's through the Department of Children and Family. This past year, it's actually had gone up a little bit. It was about $24,000. In past years, it's maybe been about $20,000. And that's for benefiting youth in New Canaan with programs, with, just things that they're doing. So various community people can ask for that funding. So the library actually was able to, if anyone's seen, they had a intern do a first installation of a story stroll, and it's in Christine's garden. Well, our grant money was able to pay for that. And if it sounds like, they'll be able to offer new stories on that so parents can stroll and read those books with their kids. And I think all the artwork was done by the intern. Amazing idea. So take a look at that if you're walking near that area. And then we also had, this might have been mentioned on a past call, but the United Way, I'm not sure how they reached out. I think they reached out to Bethany, but they had $200 gift cards that families that were affected by COVID could utilize. We were able to actually provide that to 20 families. So we really looked at families that were directly affected. We had a couple of clients that, had COVID. I actually have one client that I'm working with that is still suffering repercussions from COVID. She's had trouble walking. She's had, rashes all over her body. She's lost her hair. I mean, really, she actually was just let go from her job because of the child with the hybrid situation. So we've been able to help her with other supports as well, but she's just one of the recipients of that $200 gift card. So we were really happy to get that. I'm trying to think. I think that's, and then I have a domestic violence. Well, our domestic violence name is the New Canaan Abuse Prevention Partnership. We have a meeting via Zoom next Thursday morning, and Sherry West will be talking about sort of resiliency during a pandemic. So if anyone wants to tune in, that's an hour meeting as well. I can provide those details. But if anyone has any questions, I'm happy to answer anything.
Jackie, thanks for a great job. But do we have any idea of domestic violence? Has it gone up, down, or anything during the pandemic?
I know we've talked before on past calls. I'm not getting that many reports. Like, I get all the reports from the police department. I've gotten a few, and I've reached out to a couple of families, particularly August. I haven't seen September. Usually there's a backlog for the police to kind of report that over to me. I would imagine numbers will go up with the start of school. Any transition is a stressful time, or if, kids being home. And I think if parents are in the home with the e-learning, that's been a stressful time. Over the summer, I know the numbers shot up at times. I don't really see it being any different than past summers. So yeah, I mean, I'll get those numbers for next month just so we can compare it.
Yeah, Jackie, just in context, I mean, are we talking about a dozen, a couple dozen?
No, I mean, you're saying over the whole duration. I think just in
Yeah.
August, there might have been like 4 calls, and that's relatively, our police department has done a really great job. I mean, I started almost 15 years ago of keeping numbers down. Again, we don't know if that means people aren't calling the police. Maybe they're going directly to the Domestic Violence Crisis Center. They have reported their numbers are going up. Maybe people are getting help directly with their own private therapists. Churches, definitely see a lot of those contacts as well. But yeah, I mean, our police department, I know that the number rose around the time of COVID when everyone was home, but I don't think, but the situations are complex, I mean, and you can read about it because somebody usually does get arrested. So you can read about, and see what those, I think there were a couple in August reported in the news. And, we follow up, the police also does a follow-up. They don't have to talk to us, but it would be beneficial for them to get resources from us. Sometimes I don't, the person might not be willing to talk at that point, but maybe they call me 6 months later. So, I mean, it is a really good sort of way to kind of get involved with families, and it depends on if they're ready or not at that time. But I'll get a breakdown for you just so you can kind of compare to see.
I know the concern a few months ago was that the incidence was up, but the reporting wasn't.
Yeah, and I
just given
think
the.
that's a tricky one. I think in my sort of experience, people I've spoken to, I've been following up with these calls for almost 15 years. When people, their names are in the paper, or I mean, we do a good job at trying to keep a lot of the details out of it, out of the papers. But people sometimes that sort of, they don't want that stigma, and then they might share with other friends. And then unfortunately, somebody might not be willing, to call the police the next time. And that's just unfortunately something we can't control. But I know that the Domestic Violence Crisis Center's numbers have continually gone up. I can see if they can give me also a breakdown of like what New Canaan residents are calling them. Just, anecdotally, I'm sure they can share that.
Jackie, I didn't want to spend a lot of time on it. I just wanted to understand the process, because typically, especially in wealthy communities, a lot of this gets kind of under the radar. And I'm wondering if when the police are there, do they, for the man or woman, are they referred to you, or are they referred to someone to follow up with, so they feel like they have an advocate for them? It doesn't have to be now. We don't have to talk about it now, but I would be very interested in how
it's
that.
Not that they're referred. I mean, I think I am mentioned. I just follow up with them. Like, I'm provided the information to follow up with them. So okay. I follow up with all of them. I don't call someone that lives out of town that's a victim, because I just don't have, the time to. So unfortunately, if they're, they might have just been in New Canaan at a restaurant, or that gets logged as a New Canaan incident. So that I wouldn't, but if they're living in New Canaan, absolutely, all of them are called.
Okay, thank you.
No, you're welcome.
I wanted to add to that. I've been doing more mandated adult protective services intakes. I've been calling their intake number and definitely putting out, handing out that number more often too, with the senior population, and adult children are living at home. COVID, they're all, they're not going out, and there's definitely a mental health component and people losing it. And so it gets very, very complicated, because they don't know whether they want to call the adult protective services, because they want to check with their other siblings first to see if maybe the dad wouldn't want it, things like that. So then I make it clear. I said, now that I've heard this story, you understand, I am mandated. I do have to call and make this intake. I have to, as a mandated reporter. And, sometimes they're relieved, and other times they're like, oh, I wouldn't have called then. And I said, no, what you did is great calling. You need to call. This is for your your parent, and this is for their safety, and this is my job too. But I said, no names will be given. No one's going to know that you called me and I called them. It's just, this is for helping and watching out for your parent. So that has definitely increased. And it's sad to see, but this is what COVID is turning into in terms for our human services department.
Well, it just really highlights what Jim is trying to do as well. And, we worry about domestic violence. We worry about elder abuse issues that don't get reported, elders being exploited, things of that are at home by their children. So it's.
You're so right, Russ. Yeah.
As long as we're keeping a focus on that, thank you guys, all of you, for what you do.
Thank you.
Also on topic, Lance, related to, thank you for your personal letter to the advertiser, telling your story as well as marketing the addiction vigil. The New Canaan Men's Club had a speaker by the name of John Hamilton who specializes in addiction-related issues, substances, alcohol, etc. He was very impressive. He is a local resource for those that need him. Lance, you probably know him. And just FYI.
Could I follow up on this, or do you want me to do it later?
Briefly, now would be fine.
Okay, well, briefly, how many people did see the 4th annual last night?
I tuned in.
I know you did. You
didn't pull it up.
Anyway, it's a good idea if you want to take a look at it, because I just had a friend, 11 years in Al-Anon, whose son overdosed just 2 days ago. And I spent some time with him and he listened last night. I think the thing that I got out of last night is the question for anyone with addiction is ask for help. And also talk about it if you have a problem. But the main thing that I got out of last night is the number of clergy. I was overwhelmed with the number of clergy that were there to help. And so anyone who has a problem at home with a son or daughter or wife or whatever with drug addiction, as I said, ask for help. And that was the message last night. And that's all I wanted to say. And also the other thing, just throwing that in, is been working with Joyce Sixsmith. She's now working with 8th graders at Saks. So she's graduated down there. So we got from 8th grade to 12th grade with help with people that decide, kids that don't want to drink. And I want to say it's out there. It is as serious as the beating of I mean, it's a problem, but it's solvable. And there's help for everybody. So I just wanted to make sure that everyone knew that. Thanks.
Thank you, Lance. Next item, commission. Any reports, comments from the commission? This is an opportunity monthly to air anything you would like to.
The only thing I would ask, and I will probably, and you'll defer me to the old business as we talk about the health department structure. We used to, early on, as I recall, receive like a monthly budget to have an idea financially where we were, how much money was remaining in the kitty. And I know as we talk about adding staff and things that Kevin loves to talk about, we'd like to just know where we are from a budgetary standpoint. I think that would be helpful for us. That's the only piece that I would like to add, especially, and maybe we're going to be talking about it when we talk about the commission composition and health department structure.
I don't think we'll have any solid numbers unless Bethany has them. But we can move that to the future and yes, report on our financial status on a monthly basis. Old business, Telemental project. Jim, it's just phenomenal what you've done. It's very impressive with the program that you've arranged, et cetera. I think you all got copies of that with your agenda and minutes, maybe belatedly. Jim, would you like to address that issue where we are?
Yeah, and since everybody has seen the written report, I'll be mercifully brief. I'll just make a quick comment in general commission business. Actually, I'm happy to see mental health is showing up in the conversation on a going basis, which is very different than it's been in the past. I like to say that if 18% of people were diagnosed with anxiety pre-COVID, anybody that is not having some form of anxiety, no matter how together you are mentally, at this stage of the game is not being quite upfront with themselves. Anyway, net of it is, things have gone very well on the Telemental program, thanks to a wonderful group that we put together to identify what the need was and how to best service, and to recruit what is 6 really terrific speakers. John Hamilton, who was just mentioned, was one of them. He is a statewide recognized guy who talks to the governor on a regular basis on this subject of substance abuse and how to maintain a better life without substance and drugs. One of the things that you'll hear in the program, alcohol consumption went up 400% in the month of March in the state of Connecticut, which tells you that it's a solution that a number of people are seeking, but it's not the sustainable solution. Anyway, so we have 6 speakers that will have all been videoed. Bob Doran and Inno Media is doing the putting together of the programs, I guess I'd call it, which will go on air sometime in early October. Probably the 8th of October is the opening target date. However, we'll start showing pieces of the puzzle in small commercials, as it were, for people like this men's club, etc., as early as the next couple of weeks. Certainly no later than the 25th of September, we'll kick off the official marketing program. But everything went extremely well. You're going to be very pleased. My plan is to send out the first program sometime in the next couple of weeks to the commission, since we are, as a commission, the sponsors of this series. And I think it's going to go very well in the community. The big thing is getting people to watch. And so marketing is going to be important. In addition to the normal stops of the media and the men's club and staying put, etc. We're going to do a mailing of 2,300 senior households in town. That will be a letter from the commission explaining why this is an important series to watch, and then an attachment. Think of it as a card that goes on your refrigerator, so you know when each subject is going to come up, who's speaking, and why you should watch over a 2-month period. So the concept is basically an introduction by Mia Handler, who's the Director of Behavioral Health for the town, for 2 or 3 minutes that sets the stage and ties into any previous programs. Then 25 minutes of presentation by one of these speakers, 2 of which are nationally known, by the way, 2 of which are state level players, and 2 are famous people locally. 25 minutes of content presentation, then a demonstration with Steve Johnson, an ex-president of the men's club, who will help demonstrate either an exercise or a couple of key points from the presentation, and then a bulletin board with a couple of follow-up resources. So that's the 30-minute program. We're going to have 6 of those. And that's about it. Basically, it's gone extremely well so far. Everybody was very enthusiastic of the speakers. So far, all of the potential customers, if you will, of citizens that I talked to are saying, we can't believe that nobody's done this, hasn't done this earlier. And there's a lot of stuff on the internet, but this is going to bring it home on a local basis, and I think very meaningful.
You have a couple.
Sure.
Question: what is our budget for this production, and who's being paid? Some of the people like Steve Johnson, I assume, is doing it pro bono, but are some of the professionals here being paid at least some amount? I just
Yes.
wonder what
Yes, all of the basic budget time is 19.2. 9.7 of that is the Genian Foundation, and 9.5 of it is the Health and Human Service budget. Basically, all of that is going to I always stumble over the innovative media.
that's Bob.
Yeah,
Okay.
which is Bob Doran.
And he's paying, there's out-of-pocket cost too. And my other comment is there's nothing about this that's New Canaan-ish. This could work in any community, so no reason to keep it within our town borders.
I think you're absolutely on. And one of the things, as you may know, Bob is going to be the head of Channel 79 in another month. And one of the things we're doing is setting up a new kind of format for 79 for New Canaan. But there's a whole network of Channel 79 community operations. And so when Bob and I are putting this final edits together, the plan is to be able to offer it to the other towns.
Yeah, great.
My last thing is, though, actually Tom had offered an idea for publicity at the last meeting that we had, and that's where I want to ask the help of the commission. We're going to hit all the normal spots of the media, the men's club, Staying Put, etc. But if you have other ideas of who will be interested in this, please let me know, and we can talk about it, because I think the content is very high, and you'll have to trust me that it is. You'll see it for yourself in a couple of weeks. But the idea of getting people, getting the horse to the well, basically, to drink the message is going to be critical. And so I would invite all members of the commission to participate in the PR and marketing of this thing. Any other questions?
No, but thank you for that, Jim. I think we will all take that to heart and spread the word.
It's really good. This started out with as a kind of a fuzzy idea, and I'm very impressed with the finished product. Excellent.
Thank you.
Next item is the health department structure. We've discussed this somewhat recently. Jen, Cheryl, and I had a lengthy discussion amongst ourselves about the health department, the need for people to assist, because Jen was overwhelmed working those 16-hour day shifts 7 days a week during the height of COVID, et cetera. We discussed the role of Bethany with that, and we thought that Bethany with their RN MPH could certainly play a role and would be available for more things like contact tracing, et cetera. So we thought that was a workable option and supplement to the quote health department per se. I know the health department now has Shannon Valerie, who's moved over, and she has somewhat of a public health background, and she's done about everything here, including contact tracing. So that's a good addition. Jen, I think Aaron is still involved with the sanitation part, correct?
No, Harrison.
Okay.
Shannon, the full timer, is the
Doing
that.
Replaced him?
Yeah,
Okay.
well, he was only 1 day a week. That he wasn't really much of a help to us.
Okay.
So the full time is.
And I guess the new item, which Jen mentioned this morning, do you want to address that, Jen, about the CDC?
To back up, like
Yeah.
from what you and Cheryl, that never came to fruition with Bethany helping us out. So we do have a grant opportunity from State DPH for a $73,000 grant over 3 years. I need to discuss with Kevin and Dr. Reed about. It's for hiring a public health nurse / epidemiologist, because the health department used to have a public health nurse. And this person must specifically work for the health department and the health department only. Cannot be shared with any other town department. They're very crystal clear in the grant guidelines about that. And the purpose would be for infectious disease surveillance, the stuff that I've been doing for 6 years now, on top of all my other job requirements. So I just need to discuss with Kevin and Dr. Reed about whether, when the grant runs out, are we going to, be able to keep that person? Because ideally, the health department does need this position, and we've needed it for several years since the position was, essentially taken away from the health department. So we have to decide by like the end of September, and I have to submit the whole proposal and advertise.
Who
Yeah,
is currently on staff full-time? When we originally talked, there were 3. What is your current full-time staff, Jen?
The same 3 plus Shannon as the 4th person. So Shannon, again, is because I'm not able to go out in the field as much for inspections, she'll be doing some of that. I mean, we've been understaffed forever. I mean, I've always done way over my hours. I mean, that's just the reality of the New Canaan Health Department. And then we're legally and statutorily responsible for the restaurants, X number of inspections of the restaurants, the salons, the public pools, the daycares, housing complaints, all infectious disease, all medical reporting, emergency response, all that statutorily is under the health department. And building permits and meeting with contractors and all the other stuff. So it's a lot that statutorily we're responsible for. And then you add COVID on top of this, just becomes a nightmare.
How do we stack up against other communities in terms of our staffing?
We're understaffed.
So like Wilson,
Darien has 2 public health nurses in addition to the other sanitarians and the full-time director of health and the secretary.
What do you think, if you were to be considered full staff, what would that be comprised? What would the staff look like? What would that be comprised of?
We need at least another, the public health nurse, and then maybe even another part-time inspector. But we definitely need the public health nurse. And we've needed it for a long time. I handled the TB case for 9 months. Measles, I've handled all of it. All the, foodborne poisoning, all the infectious disease stuff, all the lead program poisoning of EBLL. I've had to handle that from the day I came to New Canaan because it wasn't being done at the time. So.
Well, it was being done. It just we had very few. I mean, so I'm happy to help out. I know, but it might be a position that through the years.
I need so with the health department though.
yeah. But is the question before the commission, Harrison, whether we should recommend an additional public health nurse be hired on top of everything else we've already got because of all the reasons Jen has gone through? And
Oh, yeah, I mean, we've addressed this, and we did think, especially with the COVID, which is a unique situation, that across the country, be it the federal, state, and local levels, that the public health was undermanned, underfunded, et cetera. So yes, we were looking at addressing that in some way. And we have increased our numbers in the health department, and with this grant that comes virtue of the CDC to the state health departments down to the local, and we'll have an RN public health for 2.5 years or whatever would be certainly a supplement. We don't know what the future will bring, but I think it would be wise at this point in time, even though it deserves further discussion, whether to not accept that grant and get that person. We don't know what things will be like, what the need will be like in 2.5 years, and no one can see ahead that far. But for the time being, I think we should move forward with it. But I think that's more discussion with Kevin and Jen and David. So I think we're better than we were in 2 senses. We have more staff and we have less COVID. So we're in a more comfortable place, but it's very, very complex, as Jen has said. I mean, and you look at all the new home sales, et cetera, and all of that going on. I mean, that adds to her job, basically.
Well, Harrison, that's why you got in. If you recall, several months ago, we talked to Cheryl about, best practices, and if there's any way, and if we maybe maybe this is something that the commission should look into. I mean, if we look at best practices and structures, and we look at where our financial positions are in our budget, and we look at and consider what other grant options that are out there, maybe that's the best approach when approaching Kevin and Cheryl with a more cohesive proposal. I mean, just adding, I don't know, to me, and Kevin's on the line, but just asking for a full-time public health nurse without putting in context of the
Not full-time.
I think would help us in that argument.
Yeah,
Well-
no, I agree with you. That nurse position that's via the grant would be a part-time position.
Correct, and that's all the public health nurse ever was, and that's all it is in every community. But there is a grant deadline by, like 2 weeks, so that the whole proposal needs to be submitted. So me, Kevin, and Dr. Reed will need to meet soon, Harrison.
Yes, we will. We'll do that. Okay, let's see.
Hey,
Next
Jen?
item.
Hey, Jen, I have a quick question on Dr. Reed. What and how big a role does he have in today's Department of Health? At one time, it was much bigger, and then it kept getting whittled down in terms of funding.
Well, he's generously, whenever I call him or email him, he's available. He doesn't nitpick over, the money amount that was, reduced to him. So no, Dr. Reed and I have always had a wonderful relationship. He's a great man and he's a great advisor. So I can't complain at all about Dr. Reed, especially when I need to go to him for medical advice, helping with, getting Stanford Hospital lined up, for the testing. So he
So
is still there.
adding more budget for David is not going to solve our problem.
Right. And
No, I need somebody here that helps with,
Got it.
I would just say that David serves on the Waveney board ex officio, and he's been doing that for many years. And he's a terrific contributor. I'm sure Russ can attest to that as well. But
he's
with the-
amazing.
No, he's played a very important role during this COVID crisis in town. To have someone like himself with his background, it's been very helpful, and he is always available. He's Dr. Gadget on his email, and sometimes he can even work it so he zooms in. That's on a good day.
Yeah, but he does have a day job over at Stanford Hospital that's more than 40 hours a week. So we're very
No, he
fortunate.
makes time for me. He is very responsive. He's amazing.
We're very fortunate. Okay, thank you.
Lastly, under old business is our commission composition. Well, there are murmurs that float around. Why do we even need a commission? Do we need a commission of 9 members, et cetera? So you always get feedback a little bit from the community and maybe even from our commission itself. So we're town charter, we are a commission, we're formed, we're supposed to consist of 9 members. And we do have a role, one of which is oversight, which we do a lot of this on a monthly basis, if not more. And but equally, maybe more important, we're all members of this community, and we have specialty backgrounds, experience, et cetera. So we're to bring forth ideas and supplements to either make our health and human services improve their function or add to their function overall. So we do have a role with this, and it's important. And I did speak to Cheryl about that, and she said when she was the director of health and human services, she found the commission to be so helpful. And I don't know, what novice she was at that time or what her experience was, but that's just one comment from the community. So presently we have 5 members. There is a maximum, there is a party alignment here that you can only have 6 from one party. So we are now we're in these, so we have 5 Republicans presently, we have 1 Democrat.
No. I'm a Democrat, so.
Are you? Okay.
So there are 2
Well,
Democrats.
you better call the town and get that fixed.
I've registered, and I've mentioned to Kevin. So anyway.
Right.
I don't know
So
if that helps.
we're there. Anyway, we are 6. So if it's 4 and 2 or whatever, and I think we all can be in the period of change anyway in our party affiliation and alignment, but we'll see. Anyway, so we do need 3 candidates, and we have 3. Kevin, you want to address that? Or you want me to keep moving? You're on mute.
Sorry, I finally figured out where the confusion came from, because Christina Fagerstall sent an email in mid-August recommending Jen Hadlick and Alyssa McKenzie and Peter Campbell. And on the other hand, there was an email from Alicia to you back in July 31st, where she was talking about Elaine McKenzie. So after getting that email from Christina, I forwarded it to Harrison so that he could make contact and interview the candidates. And with the storm, this was sort of delayed. I wanted to get these on the agenda for next Tuesday. But Harrison, where do you stand in terms of, you try to reach out to Elaine when in fact he's recommending Alyssa?
I did speak to Elaine, and she was ready, willing, and able. And I had her CV. But that being said, Alyssa, her daughter, was the person who also has, I think, a very appropriate for HHS background. And she is the person that was vetted by the Democratic Town Committee, and I think she would be fine. Basically, would be fortunate to have her. She is a person with, she's youngish, latter 20s, I think. She has her own medical issues, gone public with it. She has lupus. She is the founder and editor-in-chief of Make Lemonade with Lupus. She's a freelance writer. She'd worked with people with various disabilities. She's a New Canaanite, went to New Canaan High School, graduated from Boston University, magna cum laude, BA, liberal arts. She's been a political consultant and a community volunteer, so I think she'd be great. And not her mother. I mean, her mother would be fine too, possibly, but she's the candidate. Jennifer Hladek is another one who is an impressive woman. I think she'd be a very positive contributor to the commission. She went to Barnard initially, completed freshman year, transferred to UC Berkeley, major in history, minor in education. She lived in San Francisco. She was very involved with homeless and runaway youth, partnered closely with social services, case managers, care providers, education centers, involved locally with a lot of things at St. Mark's, Saks, PTCs, high school, just about everything. I think she would be another positive contributor to the HHS. And Angela Wilson and Kevin, I don't know the process. So the Democratic Party has to, the town committee has to vet. I don't know if they've vetted this Angela Wilson. She is a licensed psychotherapist, pediatric practice, nurse practitioner. She attended Boston University, got her BSN there, and then did some child and family psychiatric nursing education, ongoing graduate school at University of Pennsylvania. She also got a master's in education. She's presently is a counselor at the Bicultural Hebrew Academy in Stanford. And I thought that she also, with Jackie, was quite helpful during COVID, consulting pro bono families, individuals during some of these crises, so to speak. So I thought she could also be a positive contributor to the HHS. And so those would be the 3 candidates. But I'm not sure that she has been vetted, quote unquote, by the Democratic Town Committee.
Well, I would ask Alicia, I don't understand the confusion over Alyssa versus Elaine, because your email referred to Elaine and her bio.
Yeah, I'm not on the Democratic Town Committee. So Harrison asked for people on the commission to give names, and so I suggested some names, but that I'm separate from the Democratic Town Committee. That they have their own, I think they directly sent you their recommendations. So it's different people.
So we have recommendations for Alyssa and Jen Hadlick, and I think I'd like to go forward with those for next Tuesday, Harrison.
Yeah, no, I think that's fine. I think that would be great. I also thank Alicia. She did a great job forwarding these names and people with these backgrounds. As Jim mentioned, the Republican Party usually sits on their hands for these things, and they did with this, although Jim did mention a couple of people, but our perspective somewhat with a little bit of demographic bias was to move the balance to younger people and also females. As you can see, we're pretty heavy-ended on the male and elderly side of things. So I think this would do a good job of balancing things too.
And I just wanted to add, I do know Alyssa McKenzie, and I think she would be a wonderful addition to this commission.
Okay, no, that's great, great.
She's fantastic.
And I guess the Angela Wilson, Kevin, I think she probably would be good too, but should go through that Democratic Town Committee vetting process, correct?
Let's just do the two for now, Harrison.
Okay, that sounds fine.
I ask a question. Going forward, what is the process for commission membership? Because I think there was so much confusion because it was done differently and informal. And so I just want to know going forward, what is the process?
We asked the DTC and the RTC for candidates, and they vet them. We also put forward other candidates, but we always ask for at least two candidates for a vacancy.
And is there a timeline? Because we've been without, I mean, the commission's been small since February, I think.
Yeah, I don't think there's a timeline per se. Things change on December 1 of every year. So, we were a little preoccupied with people transitioning, leaving the board, zeroing in on COVID, et cetera. It became a back issue. I mean, personally, I don't know if the charter says 9. I don't know if you need 9 people on this commission. I think 4 or 5, 6 would be fine, but whatever. The number in the charter says 9, so we'll direct ourselves to 9.
So Harrison, the thought process is we bring 2 on now with Kevin, and then look at 2 more around December sometime potentially.
Well, it'll be 1 more to make it 9, but yes, people will be leaving at the end of the year.
Okay.
Potentially.
Any other items, new business? Any new business out there? Kevin, Bethany, nothing. We're good.
This is Jackie. I just wanted to thank Alicia. She also helped us with NCL to get school supplies and masks, and we were also able to give those to our clients, and we were going to give some more out at our food pantry. So I missed that and was hoping to get a chance to thank her. Thank you so much. Honestly, the masks were such a help for I had so many families because we picked.
I love them.
We picked some for the clients because we weren't letting them, come in and touch them themselves. And I got so many thank yous on there were camouflage ones and just really fun printed, they were thrilled with that. So honestly, that made a lot of people's school year. So thank you again for that.
That was an NCL drive. And then also the New Canaan Moms Facebook group were able to give money for the $50 gift cards.
Such a big help, yeah.
Great.
Okay, thank you. We will have a motion to adjourn.
Motion.
Second.
All in favor?
All right. Thank you.
And have a very enjoyable Labor Day weekend. Our next meeting will be October 1st, Thursday, 8:45 a.m., and it will be Zoom meeting.
Okay.
Thank you for your attendance today. Stay healthy.
Be safe, everyone.
Bye-bye.
Be safe. Bye-bye.
Okay.
You too. Bye.
Bye-bye.
Have fun, Tom.